A patient walks into your clinic, or you have a patient and you see him in a ward round and he's suffering from some sort of a psychological ailment. You're trying to figure out what kind of a therapy to be devised for that particular patient that you're dealing with. Now, there is again a range of therapies available for the treatments of the psychological ailments, ranging from the cognitive therapies to behavioral therapies, and then we have the REBTs, then we have the humanistic approach therapies that are sometimes devised. So all of these therapies have their own risk versus the benefits ratio that is sometimes devised in that particular patient, and that is basically for that particular patient who's suffering from that particular kind of a mental disorder. So if a patient is suffering from some sort of depressive episode and you think it is some sort of a mild kind of a depression, then you should choose a therapy which is known as a cognitive therapy, that is just dealing or taking time out to let the patient talk and give a catharsis to his or her feelings. So this is basically how you basically provide an insight to the patient towards his or her problem, and as well as you are discussing the pros and cons of that particular kind of a thought form or thought content, or the disorder in his mental thoughts and delusions and hallucinations that he's suffering from, and you're giving him an insight along with the pros and cons, and you are also trying to discuss the treatment guidelines. If he has the insight, he's able to decide what is wrong or what is right for him, then you can give him the options to choose between the different kinds of therapies that can be devised for him, and he or she may help you into identifying the treatment which is the most suitable for him or her. So this is basically the basis when you're treating patients with psychological ailments. You have to give them an insight and you have to let them choose between the range of treatments if they are able enough, if they are sane enough to decide between the range of treatments that are available to them. So this is how you go about and start treating these patients. Now, mostly these psychotherapies are of the verbal kind. So usually there is a doctor-patient rapport relationship that has to be developed. The communication skills are to be excellent to have a better prognosis, to have a better outcome in these particular kind of patients that we're talking about. So over here in this particular section, we'll be discussing a kind of a therapy or a kind of approach that is sometimes used, and it's basically quite a commonly used approach, which is known as the cognitive behavioral therapy, or it's also abbreviated as CBT in a lot of cases. So over here, first of all, we'll be discussing the different sorts of distortions that are provided by the patient, and that basically leads to the hindrance in the treatment when they are being carried out, the hindrance in the verbal treatments when they are carried out. So we'll be discussing the advantages of this kind of an approaches. Obviously, when you are talking about any kind of treatment, it can be the psychotherapies and it can be the pharmacological therapies. They have their usefulnesses or advantages, and alongside they have their side effects, or it can also be regarded as disadvantages. When we are talking about the psychotherapies in particular, you don't have the side effects, but you have the disadvantages of a particular kind of a psychotherapy. So what are the usual disadvantages? We'll be discussing them over here. We are also going to compare the cognitive therapy with the other kinds of the psychotherapies, ranging the humanistic approaches, how it differs from the humanistic approaches, and then the behavioral therapies, in which we have the classical conditioning phenomena, which is quite commonly seen, and then we have the operant conditioning phenomena that is associated with the behavioral therapies that are being carried out in a lot of cases. So mostly the treatments, the psychotherapies that are used nowadays, or that are the modern techniques that are being used, are the CBTs, that is the cognitive behavioral therapies, or they can be the behavioral therapies depending upon the case, or depending upon the disease or the psychological ailment that you want to treat in that particular patient. So over here, we're going to talk about, first of all, the cognitive therapy in this particular case, a therapy in which the focus is on helping clients recognize the distortions in their thinking and replace the distorted, unrealistic beliefs with the more realistic, helpful thoughts. So over here, if we compare these treatments with the older treatments, you will just have a look over here. That is basically a treatment in which you're giving an insight to the patient, and along with that, you're also giving him the rationales towards the helpful thoughts rather than the irrational thoughts that he or she was suffering from. So this is known as the kind of the therapy which is known as the cognitive therapy over here, and which is basically the replacement of these distortion thoughts or the unrealistic beliefs with the realistic thoughts over here. So when we talk about the different kinds of cognitive distortions that a person can suffer from, it can be the arbitrary inferences, drawing a conclusion without any evidence. So this is one of the distortion that you come across when you treat these patients with the psychological ailments over here. Then we have the selective thinking phenomena that is quite commonly seen. And what happens over here is that focusing only on one aspect of a situation while ignoring all the other relevant aspects in this case. So this is basically a one-directional sightseeing or one direction selective thinking that is observed in these patients. Then the overgeneralization phenomena, drawing sweeping conclusions based on only one incident or event and applying those conclusions to all the events. So this is the phenomena which is known as overgeneralization, and this is also sometimes seen in a lot of patients who are suffering from psychological ailments. Magnification and minimization. So it's basically magnification a problem or magnifying a situation that has occurred in one's life, blowing a negative event out of a proportion, magnification, while ignoring the relevant positive events along with that. So this is known as the process of magnification when we talk about it. So over here we have another phenomena which is known as personalization, taking responsibility or blame for events that are unconnected to the person. So this is the range of disorders that can be seen along with their explanations over here. We have the arbitrary inferences, selective thinking, overgeneralizations, magnifications, negative thinkings or personalizations that can basically cause a hindrance towards the treatment in a proper way. Then we have the CBTs known as the cognitive behavioral therapies, the action therapy in which the goal is to help the clients overcome the problems by learning to think more rationally and more logically. If we look at this triangle or the triad of this treatment, it's that we're dealing with the thoughts, the behavior, and even the feelings of the patient. So this is how you change the person, giving him an insight as well as giving him reasons towards the rational thinkings or the rational problem solving phenomena. Now, what are the goals over here? Relieve the symptoms and solve the problems, help develop the strategies for solving the future problems, help change the irrational, distorted thinking in these individuals. And basically, this is how we have that particular outcome carried out in these patients who are being treated with these cognitive behavioral therapies in these cases. So this is one of the modern techniques that are being used these days. They have their advantages and they have their disadvantages as well. Dealing with those particular distortions that we've already talked about, the outcomes can be sometimes quite miraculous in these patients. So that is the end of this section. Thank you for watching sqadia.com.